Hello, I am Dr. Sushma Harish. While there are many symptoms in the pregnancy which are harmless, there are certain red flag signs which should never ignore, like severe vaginal bleeding, severe lower abdominal pain, decreased baby movement, especially in the third trimester, persistent headache, visual disturbance, epigastric pain or vomiting, or when there is watery leak or discharge before 9th month, or when there is onset of labor pain in the early, like around 7th or 8th month, when there is on and off pain or contraction like pain, or when there is decreased fetal movements, you have to consult your doctor immediately. While spotting or altered vaginal discharge like brownish, scanty discharge are common in the pregnancy, but heavy bleeding or associated with clots or passage of greyish tissue is dangerous. When it happens in the first trimester, it is a sign of miscarriage, but if it is happening in the later time of pregnancy, when there is clots or heavy bleeding, it may be a sign of placenta previa or abruptio placenta, which you should not ignore. Well, mild cramps in the abdomen is common throughout the pregnancy because of stretching and growing uterus, but severe abdominal cramps associated with bleeding or decreased fetal movements in the later part of pregnancy may be a sign of miscarriage, ectopic or placental cause in the later trimester of pregnancy, which you should never ignore. Usually you can feel fetal movements or fetal kick by the end of 4th or the beginning of 5th month, that is around 20 weeks of pregnancy, but regular fetal movements are appreciated after 28 weeks of pregnancy. When you feel the movements are decreased or there is no movements in the past 2 hours, it will be an alarming signal. Usually you can measure the fetal movements, like each hour you can measure after each meal, like 1 hour in the morning, 1 hour in the noon and 1 hour in the night. Total it should be around 10 to 12 movements, or your first 12 movements you can count, and if you have finished 12 movements in that day, you can stop counting. But decreased fetal movements is an alarming sign and has to be evaluated. Slight headaches are common in pregnancy, especially the frontal headache, which may happen because of dehydration and hormonal changes. But severe persistent headache in the back, in the occipital region after 20 weeks of pregnancy indicates it may be a sign of severe high blood pressure, or we call it as eclampsia, preeclampsia syndrome, or if the headache is associated with blurring of vision, epigastric pain, continuous vomiting, decreased fetal movements, limb edema, then it is an alarming sign which has to be evaluated immediately. When there is heavy bleeding from the vagina, decreased fetal movements, persistent vomiting and headache, when there is gush of water from the vagina, or when the labor pain start before 37 weeks of pregnancy, all these are an indicator for immediate care.